tooth pain that occurs specifically when biting down, whether while chewing food or even at rest, often points to an underlying dental issue requiring attention. This localized discomfort typically stems from one of three common causes: a cracked tooth, tooth decay, or a loose filling. 1. Cracked tooth. Cracks or fractures in teeth can develop from biting down on hard objects or due to stress from large, aging fillings. These hairline fractures may initially go unnoticed, but can gradually expand over time, compromising the tooth's structural integrity. As the damage progresses, the pain often intensifies, particularly when pressure is applied during biting or chewing. 2. Tooth decay. Decay weakens the tooth's enamel and underlying dentin, leaving it vulnerable to damage. Even minor force from biting can aggravate the compromised area, triggering pain. Left untreated, decay can deepen, increasing the risk of infection or tooth fracture. 3. Loose filling. A filling that has become loose or dislodged exposes the vulnerable inner layers of the tooth to bacteria, temperature changes, and pressure. This lack of protection often results in sharp pain when biting. If unaddressed, the filling may fall out entirely, leading to further complications such as reinfection or additional decay. In all cases, pain while biting signals a need for prompt dental evaluation. Early intervention can prevent worsening damage and help preserve your oral health.